Thank you for those of you who are here for sometimes making the rather hard journey to get here. And thank you for all those of you who are online and are going to participate via a webinar. We have a very good program here today, and I'm hoping that the mechanics will work and that we will all be able to hear and see the presentations. I'm Frank Loy. I'm the chair of the Roundtable. And on behalf of the Roundtable on Environmental Health, Sciences, Research, and Medicine, I want to thank you for joining us for today's workshop on the interplay between environmental exposures and obesity. We used to think about obesity in terms of nutrition. I mean, that's what my parents told me. I bet you that's what your parents told you. That's what you tell your kids, probably. And that's what the self-help books all have talked about. And in large part, of course, that's absolutely right. And we, not we, but those of us in the audience who are in the public health community certainly don't want to get in the way in any sense of nutritional advice and nutritional guidance. But as we understand better the complexity, the relationship between obesity and or the statistical likelihood of becoming obese, all of that becomes more complex. And it involves an interplay between the academic health community, those that focus on public health, and on the environmental health community, those that focus particularly on environmental health. And it turns out that it requires thinking about both in order to come up with some reasonable thinking about obesity in our society. Only when we understand the complex origins of obesity or the likelihood of becoming obese will we really be able to deal with this huge health problem and huge economic problem in our society. That's what we're about today, and I'm quite excited to launch this, in large part because we have such a distinguished group of presenters. Before we start, I'd like to thank the Planning Committee for their work in creating today's agenda. A lot of conversations went into that planning, and the members of that committee include Henry Anderson, Kathy Boz, Linda Birnbaum, Gwen Coleman, Lynn Goldman, Richard Jackson, Patricia Verdun, and Sadhu Witherspoon. Some of these individuals are here, some aren't, but we owe them all a thanks, a great vote of thanks for the work they did in bringing us to this point. I also want to thank the members of the Roundtable who are here and give specific thanks to the sponsoring organizations that help make these Roundtable meetings possible. And they include Colgate-Palmolive Company, US EPA, ExxonMobil, the Kresge Foundation, the National Institute of Environmental Health Sciences, we're in their facilities here today, Royal Dutch Shell, and the U.S. Geological Survey. Thank you for your financial and other help in making this meeting possible. Finally, I want to thank the IOM staff that has worked on this meeting and works for the Roundtable so diligently and effectively and with such good humor. That's Kathleen Stratton, Aaron Rush, and Hope Hare. Hope is not here because the last time I saw her, she was still at the airport waiting for the 4 times delayed flight. Now, before we get to the first panel, I wanted to introduce Linda Birnbaum, who's a member of this roundtable, and we're happy to have her. We're very pleased and proud to have her on the roundtable. And she is a director of the National Institute of Environmental Health Sciences and the National Toxicology Program, located here in Research Triangle Park, North Carolina. Linda is a certified toxicologist and has served as a federal scientist for a long time with enormously beneficial results. She's a diplomat of the American Board of Toxicology, a fellow of the Academy of Toxicological Sciences, and a member of the Institute of Medicine. Linda, thank you for hosting this, and welcome.